Bonjour à tous, 6e semaine de confinement et je dois dire qu'au début de la semaine, je trouvais difficile de percevoir les signes d'espérance avec la tuerie qui est arrivée en Nouvelle-Écosse où 23 personnes ont perdu la vie. Ces drames nous laissent souvent en état de choc. Et vous savez aussi sans doute que nous avons eu un cas positif, aujourd'hui 2 cas positifs dans la communauté de Daybreak. Une personne est hospitalisée, Tim, qui est en soins intensifs. Une autre personne testée positive dans un des foyers. Et Trish, avec qui nous avons eu la possibilité de parler cette semaine, nous disait combien de passer dans un état de confinement à un état d'isolement était quand même très très lourd. Vous allez entendre un extrait d'une interview que Michael a eue avec Trish cette semaine qui parle de la situation à Daybreak.
Hello?
Hey, Trish.
Hey. Sorry, I'm in my car. I'm on my way home. But my hands are on the steering wheel, so
Okay.
there you go.
Okay.
Just in case you're like, where are you? I'm in my car.
It's okay. What I've been hearing is that you guys have been doing some really, really great work in responding to this. I've been talking to lots of different people, and we're just trying to hear some best practices, some ideas, just to let the information circulate so we're able to learn from each other right now. And also we're learning that when you're doing scenario planning, it's not community or house to house, it's literally person to person. So the more examples we have of what people are doing person to person, I think the better prepared we'll be.
Honestly, it was like one of the saddest days, I think, of all of my years in L'Arche. You know, it was just such a hard moment. I walked into the greenhouse, and they were already on the phone with 911. Clara just looked at me. She's like, this might be the last time we see Tim, you know? It was a really, really hard moment. And then, let's come around Tim, let's PPE, let's get full PPE on. Let's come around Tim, let's pray. Like, let's say goodbye to him, you know? And so that's what we did. And, poor Tim, he was really struggling. And then the paramedic came in, and the paramedic knew him. He was like, yeah, Tim, I grew up next door to him. And I was like, really? Are you serious? So he's like, yeah, I grew up next door to Tim. We were neighbors. And he's like, I see you guys all the time at Joe Hamburgers. And so, you know, it was this kind of nice moment there of sending Tim off a little bit, you know, but also we were just all in shock too. Like, how did this happen? Because no one up until Tim got sick had any symptoms in our community. The first thing people need to do, like right now, if you have not siloed all of your assistants to one home, do it now. Everything from, like, this assistant has their bedroom in that home, but they're actually on a team at another home. And the other thing I would say is public health is saying you need to have a PPE station outside every single person who's sick outside their room.
Wow.
So, you know, like when you think that through, it's like, okay, so you need gowns, you need gloves, you need masks, you need face shields. Then you need tubs to put dirty, when you're done with the shields and you disinfect them, you actually need to store them safely so that later you can clean them. Then there's the laundry bins for the gowns, and they need to have a liner in them. And you have to actually outline systems in homes, like around all of these things that very quickly you're going to be in the middle of it. It's an administrative piece that actually communities could do right now. Suddenly you need access to things, and your admin people are actually not in the office, and maybe some things they don't have access to, but you kind of need them immediately. Communities should have their lists really ready. You need all of your assistants, employees, you need their birth date, telephone number, I would even in advance ask them for their health card number. I mean, maybe we can't do that, but know how many bedrooms are in a house, know how many live in, live out. You need to have all of that information, and you have to be able to repeat it to like 10 people. Honestly, there's no information sharing in public health, so you gotta keep repeating all of that information. There's a shortage of PPE in the world. You will not be able to get any disposable gowns. I've learned that. So we've tried everywhere. We can't get them. So we had started making them, and we had 100. And I can tell you 100 is not enough. You need like 300 for our size, more, 400 for our community. I mean, you go through them. We made a ton of those face shields. We were able to actually buy some too. And Jim knows a guy who knows a guy, and we got a huge shipment of like surgical masks. I don't know how he did it, but there's a boat from China sitting down in Toronto, and Jim was able to get us surgical masks, so we took them. So get a sewing club, make them for you. Once you're in an outbreak, you're going to need to use disposable, and hopefully you have a supplier, but the cloth ones will help you now. But yeah, gloves too. I mean, people need to have everything they can stocked up, ready to go. I actually have some really good lists that public health sent me in this outbreak scenario. And I just think it's really good for people to see this. Like, it will be what's expected of you right now, but just checklists. And then you need to track these things called line lists. So every day I have to submit line lists to public health about every single person who's symptomatic or any changes to their symptoms. And then I got to submit lists of everybody who's been tested. So.
And what is a line? What is a line list?
So it's a document. They give it to you the minute you have either an outbreak confirmed or you have suspect outbreak. You begin tracking who has symptoms, and anyone symptomatic goes on the line list, and you have to track their symptoms.
Okay.
The other thing that we learned with Tim was you've got to, as much as possible, have conversations with families around advanced care planning. What happened with Tim was he deteriorated so quickly. He went from, he's got a fever, maybe 10 o'clock, he's got a little bit of a cough. And in the morning, he's in respiratory distress, and by the time he gets to the hospital, he's in respiratory failure. Like, that's how quick it moved. And he's a healthy guy, so the ambulance showed up. We can't go with him. We can't go into the hospital. And the doctor called us, like, what's the plan here? Like, he's in respiratory failure. And his brother, who's the substitute decision maker, is out in Vancouver. And the doctor called us back and was like, you guys have to be prepared. Doctors are not going to have a lot of time to be chasing down power of attorneys and what people's wishes are, And, I mean, in the end, it was an easy decision around Tim. We and his brother are on the same page, like, do everything you can. But it was really clear for the hospital, he needs to be on a ventilator, like, immediately, So anyway, we reached out to all our families, and families are very supportive about it. It's difficult conversations, but no family has kind of been like, oh my God, what's wrong with you people? So yeah, and I think just, people being prepared. Anyway, Michael, I should go.
Thanks, Trish.
Bye.
Yeah.